Approximately 90% of the time when I reveal to someone that I'm chronically ill, they don't actually understand what I mean. The word chronic has become synonymous with the word bad, so people simply don't understand that when I say I'm chronically ill, I mean that I'm permanently ill, that there is no treatment or cure which will rid me of my ailments. My illnesses are well controlled now for the most part, but I definitely still get the odd reminder that I am not and will never be completely healthy. There are various definitions of chronic pain, which mostly differ in the length of time that they would consider someone to qualify as chronically ill or to qualify as a chronic pain patient, which is not a title anyone actually wants, of course. I have seen some articles state that 3 months is this magic point because that is often regarded as the usual tissue healing time. However, some articles refuse to label symptoms as chronic until they've been ongoing for at least 6 months. One of the things which makes life as a chronically ill person even harder is the long time it takes to get a diagnosis. I struggled to find proper stats on this, but from being a patient myself and from being in multiple chronic illness groups, I could say with a good amount of confidence that it usually takes years to get a diagnosis. And this is because there's a great number of simpler conditions which must be ruled out first with a battery of tests, and some of the tests themselves can take quite a while to get done. Humans are fragile creatures. There is an insane number of things which can go wrong for us, and often for no apparent reason. The causes of chronic pain vary widely, which result in different types of pain. The most common types of chronic pain are back pain, headaches, joint pain, and nerve pain. But there are a plethora of pain conditions, and many of us have more than one. I myself have got several chronic illnesses. Some of them I was born with, and some I acquired over time. One of the major problems with chronic pain treatment at the moment is that the sheer number of sufferers is grossly underestimated. In a study undertaken by the British Pain Society in 2016, it was revealed that 2/5 of the UK adult population suffer chronic illness, and 14.3% of those have pain that is moderately to severely disabling. In an article released earlier this year by The Guardian, it was revealed that 1 in 3 adults in England suffer with chronic pain. 1 in 3. This figure really is extraordinarily high, and it highlights just how much of an issue chronic pain is in our society today. I would go so far as to say that everyone probably knows at least one chronically ill person. I mean, for a lot of us, our symptoms are invisible. We don't look sick. I've had that said to me more times than I can count, and although it's okay now, it used to really hurt me. It's like people basically saying, "I don't believe you." Now, I imagine that 99.9% of humans on this earth have been ill at some point in their life, whether it be a common ailment such as the flu, a less common but still very minor ailment like tonsillitis, or a serious but still eventually healed injury like a broken arm. People usually take it easy when they're unwell, taking time out of work and other commitments in order to recover. Chronically ill people don't really have this luxury. Of course, the absolute worst of us are completely disabled. I myself was bedridden for nearly 7 months with one of my illnesses before I got on the right treatment, and yes, it was utter hell. However, the majority of chronically ill people, who I know at least, have to just struggle through. Chronic illness affects every area of one's life. Work, relationships, family, hobbies. Even simple day-to-day tasks such as cooking and bathing can become incredibly difficult. Long-lasting, terrible symptoms are both physically and mentally draining. The able-bodied will just never understand. hardest things for me at the height of my illness was sleeping. When my migraines were untreated, I once stayed awake for an entire week. I felt absolutely delirious by the time I was strapped into an ambulance by 2 paramedics. And this is a common complaint among us chronic pain patients. In a study undertaken by the National Sleep Foundation in the US, it was discovered that only 36% of chronic pain patients felt like they got adequate quality sleep. The next area of my life which was greatly impacted by my illness was work. As you'll have seen in a previous video, one of the deciding factors for getting fired from my last traditional job was the frequency and severity of my migraines. And this bias is so incredibly common. Leonard's Cheshire, a volunteer service which provides support to disabled people in the UK, found that only 51.3% of disabled people in the UK are employed. And yes, chronically ill people are disabled. Disability is so much more than being in a wheelchair or having missing limbs. A disability is anything which affects your ability to carry out day-to-day tasks like normal, which chronic illness most definitely does. And because of this, many chronically ill people struggle financially. And as people in the UK are probably aware, our welfare system is far from perfect. Universal credit is not really enough to live on, especially for those of us who have to fund some or all of our treatment by ourselves. One of my conditions is simply not recognised by the NHS or NICE, which is the governing body which creates the guidelines for how different illnesses should be recognised and treated. So I receive private treatment for one of my conditions at Harley Street in London, which is not cheap. Another difficulty for us chronically ill patients is an unfortunately necessary evil: the treatment itself. So, what can I help you with today? Well, I'm in pain. A lot of it, actually. Okay, where is your pain? It's in my pelvis, my bladder and lower back. I feel like someone's standing on them. Well, have you tried any over-the-counter painkillers such as paracetamol? No offence, but I wouldn't have booked a GP appointment if paracetamol had worked. Now, there's no need to be rude. Apologies. The pain's making it hard to think. Well, let's examine you. I can't feel anything out of the ordinary. You know, to be sure, let's do a urine test. Did the test show anything? No, good news, you are perfectly healthy. Well, clearly I'm not, or I wouldn't be in pain. What exactly do you want me to do here? Treat me? Maybe prescribe a better painkiller than paracetamol? I'm really struggling and I just lost my job. Well, there's simply nothing for me to treat. I'm sure you've heard of the opioid crisis and you can understand why I'm not going to prescribe you one of those. The reenactment you just saw was completely legitimate. That conversation, naturally paraphrased slightly, happened to me. At that point, I had only been in pain for a few weeks, and I had no idea of the suffering which would plague the next 2 years of my life, even after I'd been prescribed codeine. Now, there is definitely a stigma surrounding opioid use. A lot of us are seen as drug seekers. I know I definitely was. But the vast majority of us don't want to be taking these pills. We don't want to deal with the side effects, which I'll touch on later. We just want a decent quality of life. Opioids have been slightly in the spotlight again lately, mostly due to media coverage of Afghanistan's opium trade and the Taliban's crackdown on drug users. I watched a documentary on the Vice YouTube channel about the Afghan opium trade, which I will link down below, and it highlights that poppies, which are used to produce opium, are by far the most profitable crop to farm in Afghanistan. So, how do opioids work? Without getting too complicated, they inhibit the pain signals at multiple steps in the pathway, from the nociceptors, nerve endings all over the body which detect potentially dangerous stimuli, all the way up to the brain. and this is one of the reasons why they can be so incredibly effective. Another reason is that, as well as inhibiting the pain signals themselves, opioids also work to reduce the emotional trauma felt by pain, and this is definitely something that I've experienced myself. In a video released by the Healthcare Triage YouTube channel, it was stated that opioid medications are so effective at treating acute pain because they attack it from every neurological angle. With all of this in mind, it's no wonder that opioids have been prescribed so often. In a paper on the PLOS Medicine site, it was stated that codeine prescriptions increased fivefold from 2006 to 2017, with 2,456 prescriptions for every 10,000 people per year. Codeine and tramadol are the weakest opioids, with less addiction and withdrawal risk than stronger ones such as morphine or fentanyl. However, they are still opioids, so this prescription increase was naturally concerning. Why are opioids so addictive? The Mayo Clinic state that opioids cause the release of neurotransmitters called endorphins, the feel-good neurotransmitters, which I'm sure most of you will have heard of. Over time, this effect weakens. Tolerance develops, and along with it, dependence. Higher and higher doses of the opioid are required to get that same level of endorphin release, and sometimes the same level of pain relief as well. This can lead to abuse of the drug, that is, taking more than the prescribed dose against medical advice. The National Institute of Health estimate that between 21 and 29% of chronic pain patients end up misusing their prescribed opioids, with 8 to 12% developing an opioid use disorder. Additionally, and more seriously, 4 to 6% of those who abuse their opioid prescription end up transitioning to heroin use, presumably in search of a more intense high. Though addiction is arguably the most serious possible side effect of opioids, there are many other unpleasant side effects. These include dizziness, nausea, constipation, urinary retention, and respiratory depression, which is when the lungs fail to exchange oxygen and carbon dioxide properly. I myself have experienced several of these side effects, and respiratory depression is as terrifying as it sounds. These side effects are all examples of iatrogenic harm, which is harm which is caused unintentionally by medical treatment. Of course, opioids are not the only treatment available for chronic pain. Welcome to Big Lab Somewhere, where I'm going to teach you about other treatments which are sometimes used for chronic pain. I've got some paid actors here in the form of some meds that I myself was prescribed for my little broken body. Rest assured, everyone receives above minimum wage. Now, treatment mostly depends on the type and location of your pain. My pain is mostly situated around my back and pelvis, but I'm also a migraine sufferer. This bad boy right here is called diclofenac. Diclofenac comes from a family of drugs called NSAIDs, which stands for non-steroidal anti-inflammatory drugs. You will have heard of a much more common and weaker NSAID, good old ibuprofen, known in the US as Advil. The main job of NSAIDs is to reduce inflammation, which is why they're often prescribed for menstrual pain. As an endometriosis sufferer, ibuprofen just never cut it for me. Another drug I was prescribed for my menstrual pain was this guy, mefenamic acid. This is also an NSAID, but it's a bit different, being an anthonylic acid derivative. Sneak preview! I'm about to go much more in depth on pelvic pain and various treatments in a future video, so subscribe if you want to see that. Steroids. No, not those steroids. I'm talking about corticosteroids, the anti-inflammatory pain relievers. Now, steroids are pretty much useless for my condition, so I don't have anything to show you with regards to that. But steroids are not really an ideal treatment anyway because they heavily suppress the immune system. Antidepressants. As an unfortunate sufferer of both borderline personality and bipolar disorders, I am intimately familiar with antidepressants. The one I'm taking right now is the iconic sertraline, known in the US as Zoloft. I can't actually comment on the effectiveness of these drugs for pain, but I've heard that they're quite good for neuropathic pain. A few years ago, I was taking an older type of antidepressant called a tricyclic antidepressant. These are not really used for depression anymore because of the extremely high doses which were required and the high prevalence of side effects, but they're often prescribed at lower doses for neuropathic pain. I'm going to touch on my experience with this drug a little bit later on in the video because it's kind of relevant to another point. Topical treatments. Fellow migraine sufferers will be familiar with this wee legend, Tiger Balm. Tiger Balm is a herbal treatment which was actually designed for muscle pain. Other common topical treatments include Voltarol pain gel, in which the active ingredient is actually the earlier mentioned diclofenac. Now, I can't show you this because I did buy it once, but I lost it. Another topical treatment that I actually used was topical lidocaine gel. Now, I didn't actually experience much benefit from this, but it didn't seem to harm me either. Besides medication, there are other alternative treatments. These include acupuncture, cognitive behavioural therapy, and physiotherapy. Even before I was a real chronic pain patient, I would often see posters like the ones I just showed in my GP surgery. The opioid crisis has been ongoing for decades now, and it just seems to be getting worse. But the main problem here is not the prescribing of opioids, which is what most people seem to think. The problem is the fact that, for the moment at least, opioids are necessary. There are no treatments which are extremely effective for any chronic pain condition, at least from what I've experienced as both a patient and a member of several patient groups. I mean, if there was something which worked particularly well, chronic illness wouldn't differ so much from acute illness. A place that many patients are referred to, though I myself have not had the pleasure, is a pain clinic. Though these do often offer the treatments I've already mentioned, they also offer something called a PMP, or a pain management program. The NHS website states that the aim of a PMP is to improve your quality of life despite your pain, rather than reducing your pain. Now, this to me sounds absolutely useless. As a long-term member of the Chronic Illness Club, I've heard it all. I know about eating well, I know about exercise, I know about yoga, mindfulness, meditation. All of those things are at best difficult and at worst completely impossible when symptoms are bad. I am a firm believer in having too much of a good thing, and nothing shows this better than addiction. I myself have been addicted to a medication, although strangely enough it was not an opioid, despite taking codeine most days for the best part of a year. Addiction is something which plagues humans. Drugs, alcohol, food. Everyone knows someone who's been addicted to something at some point. And addiction has many causes, both pharmacological and not. The medication that I was addicted to does that to every patient, which is why there's a very slow weaning process when you come off of it. My script ran out one day and I experienced withdrawal. It was absolutely horrendous. I shook uncontrollably, the pain in my joints was awful, and I was horrifically nauseous. When I came off that drug for good, I was very vigilant with weaning down, slowly. In case you're curious, this was the previously mentioned tricyclic antidepressant. Addiction affects so much more than just physical symptoms. Opioid addiction itself is considered a chronic illness. The most dangerous effect of drug addiction is the possibility of overdose. The World Health Organization site states that 70% of drug-related deaths are caused by opioids, with 30% of those being caused by overdose. With the increase of opioid prescriptions came the increase of overdose. This graph shows a clear upwards trend, which is of course concerning and of course needs to be addressed. An article written by the Faculty of Pain suggests that opioids are not a particularly effective treatment for long-term chronic non-cancer pain. I'm not going to go off on a proper tangent here, but I hate the term non-cancer pain. It insinuates that pain which is not caused by cancer is somehow less severe or less serious, and in my opinion, it diminishes the pain of other chronic illnesses. The main factor which vetoes opioids as great long-term pain management is the high prevalence of side effects. One Danish study actually suggested that opioid users tend to have a worse quality of life and sometimes even worse pain levels than non-opioid users. Despite all of this, I don't believe that the answer here is to stop prescribing opioids to patients who need them to lower their pain enough to function. Codeine was a lifeline for me on many days when I actually needed to leave the house, for example, if I had a dental appointment or something. And I know many patients who needed even stronger painkillers to make it through the day, such as morphine. Chronic pain and chronic illness in general are not given the attention they deserve. There are so many of us for which no treatment works at all, or works well enough to live any semblance of a normal life. I mean, I myself was like this before I started my expensive but worth it private treatment. And illness is something which doesn't discriminate. Anyone can become ill at any time. I mean, I certainly never expected to get most of the illnesses I have. The current treatment regimes are simply not good enough. We need new treatments, and we need them now.